everyone, and thank you so much for joining us for another edition of Educating for Public Health Literacy with Tolu Omodara here on Amogate Radio Communications. It's been quite interesting week after week, episode after episode, and today we are going to continue from where we stopped at the last episode. So during the last episode, we looked at the National Action Plan, right, for public health literacy in the United States of America, and we looked at the 7 goals of the 7 objectives created for that particular national action plan. I'll run over them very quickly for those who may not have been here or even may have been here and would want a reminder. So they had 7 main goals for that national action plan to improve health literacy. The first one was to develop and disseminate health and safety information that is accurate, accessible, and actionable. I'll repeat, to develop and disseminate health and safety information that is accurate, accessible, and actionable. So accuracy, accessibility, and implementation were critical. It was a prior goal, the very first goal, that health information must be accurate, no misinformation, right? It must also be accessible. What's the point of having information that cannot be accessed? How can it improve literacy? And also actionable. We've kept saying that the definition of health literacy includes the ability to act on that health information ahead of medical intervention, right? So that people can take the actions that they can take on their own and they should take on their own, not the ones they shouldn't take on their own, but the ones that they should and can take on their own if equipped with the relevant, accessible, and actionable health information. So this was the prior goal of that National Action Plan to improve health literacy, to develop and disseminate health and safety information that is accurate, accessible, and actionable. Number 2, to promote changes in the healthcare delivery system that improve health information, communication, informed decision-making, and access to health services. I repeat, to promote changes, right, in the healthcare delivery system that improve health information, communication, informed decision-making, and access to health services. Of course, there is still the place of informed decision-making in this second goal, but one thing to note here is that they were looking at the healthcare system as a whole, right? One of the things we've kept saying in this program, when I say this program, this series of programs that we've been having since September 2022, we've kept saying that public health is systemic. I'll refer again to Dr. Mololu Imajekudumi. He emphasized that a lot, and you will see that a lot if you follow public health issues. You would see again and again public health experts emphasizing the point that a number of factors come together to form public health. It's not just the medical aspect of public health. When we talk about public health, several things inform it. There's the transportation part, there's the education part, there's the nutrition part, of course. So many things come together to make up the health system, the public health system as a whole. So you find the second goal of the National Action Plan to improve health literacy in the United States, emphasizing that, right, to promote health changes in the healthcare delivery system that improve health information, communication, and this will lead to informed decision-making and access to health services. We've said this in the last 2 or 3 episodes. What exactly is the point of health services that people are not aware of? Those who are supposed to benefit from the health services, if they are not aware of the availability and the access points of such health services, then it might as well be a waste, or at very minimum, a sub-optimization, right, of the investment. So the second goal is to promote changes in the healthcare delivery system that improve health information, health communication, informed health decision-making, and access to health services. The third one was to incorporate accurate, standard-based, right, and to develop appropriate health and science information, right, and to ensure that the curriculum is available to children and as well as education all through the university level. In other words, they want to incorporate accurate, standard-based, and appropriate health and science information and curricula into childcare and education all through the university level. I think we dwelt a lot on this, how we've been talking about this episode after episode, that there are two key segments of the population as far as health literacy is concerned. There are those that we can say have already gone through the traditional school system, and for whom we have to devise some sort of innovative channels to ensure that we continue to health educate, if I can put it that way. And there are those that are still in the traditional systems of K to 12 or nursery, primary, secondary, like some other countries call it. And for these ones, it might be easier to incorporate health education, right, which leads to health literacy into the traditional curriculum and education systems. And so much as it is already existing, it's still important to emphasize it as one of the goals of this National Action Plan, or it was still important to emphasize it as one of the goals of this National Action Plan to improve health literacy. And that was the goal 3, to incorporate accurate, standard-based and appropriate health information and curricula into childcare and education, all the way from the kindergarten to the university level. Now, goal 4 was to support and expand local efforts to provide adult education, right, English language instruction, and culturally and linguistically appropriate health information services in the country. I'll repeat that: to support, and where it exists, expand local efforts to provide adult education, English language instruction, and culturally and linguistically appropriate health information services in the country. Let me quickly give us a little bit of context to it. So the United States is a multilingual and multi-racial as well as multi-ethnic society. So you have different languages here. So the focus here is to make sure that no language or no tribe or no race is excluded, right, because of limitations of language and cultural expressions. So this is like an inclusive approach to health education, to make sure that the language and the cultural context of the communication does not exclude those whom it should include, right? So this 4th goal spoke to inclusivity, which is important, right? To support and expand local efforts to provide adult education, English language instruction, and culturally and linguistically appropriate health information services in the country. The second thing to note about this, like I said earlier, is that while the 3rd goal was to sort of consolidate the traditional educational systems of health education for health literacy, the 4th goal is now looking at how to optimize the access points for the adults who have already gone through the traditional education system and whom we have to devise means of ensuring we keep reaching. So goal 3 is for that first segment of population who are still young and who are still going through traditional school systems and who can still be very well health educated with some level of ease, while the 4th goal is reaching the adults who have already gone through the traditional school system and whom we may need to think of creative ways. The last episode we talked about organizational health literacy. Organizations, for instance, many adults work, so we may need to be incorporating health education into the training and development services or the training and development policies of organizations. That's one of the creative ways we've looked at. Now, the goal 5, the 5th goal of this National Action Plan to improve health literacy, was to build partnerships, develop guidance, and change policies. I repeat, to build partnerships, develop guidance, and change policies. We're going to dwell a little bit on this today, and I'll explain further as we go along. Goal 6 was to increase basic research and the development, implementation, right, and evaluation of processes to improve health literacy. This is very important. We talked about this a lot in the last episode. I won't dwell on it. In other words, it's important to evaluate how this is working, right? If it is working, what is working about it, what needs to be improved, and so on and so forth, right? And this is another thing we'll look at from another dimension today. We're going to look at goal 5 from another dimension, goal 6 from another dimension, and finally goal 7 to increase the dissemination and use of evidence-based health literacy practices, right? And of course, this can only come out of goal 6. It's only when we have evaluated what is working and what is not working that we can then begin to talk about increasing the use of evidence-based health literacy. In other words, is after we have generated the evidence through evaluation, through research, right? That's when we can now begin to talk about using the ones that the evidence suggests are more effective. So these were the 7 goals, or these are the 7 goals of the National Action Plan in the United States, right? The National Action Plan to improve health literacy in the United States, which was created, as a matter of fact, about the year 2010, right? Year 2010. Now, we're going further today. Remember, we've looked at a couple of countries in the course of this program: Australia, the United States. Today, we are going to another country in Europe. We are going to Germany. right? But we are going to look at the last two goals, right? The third to the last and the second to the last goals of the United States Action Plan to improve health literacy, and connect it to what was done in Germany. Now, one of the first things to note about the German Action Plan, right? So they called it the National Action Plan for Health Literacy, right? One of the first things to note is that they actually did this a little bit more recently. As far as our research indicates, this was done in 2018, which was about 8 years after the United States Action Plan to increase health literacy was done, right? Now, another thing I want to point out is that they also sort of reviewed what had gone on in other nations. Remember, I said I was going to come back to point 6, right? Which is the one that talked about evaluation, the goal 6 of the United States National Action Plan to improve health literacy, the one that was created in 2010. So Germany started by looking at what had worked in other nations, what had worked, what had not worked, at least for this 2018 National Action Plan for Health Literacy. And one of the things they saw is that generally, nations were sort of having issues with the implementation of health literacy plans. I'll repeat that. As Germany started out to develop this 2018 National Health Literacy Plan, they began by reviewing what had gone on in other nations, which is always a good place to start. It's always, you don't need to reinvent some wheels. There are times to be creative and there are times to be cumulative. I'll repeat that. There are times to be creative and there are times to be cumulative. So it's always important to look at what has worked, what has not worked, why did it work, why didn't it work, right? So Germany looked at a number of nations and they saw that generally national health literacy action plans were having issues with implementation, right? And I think we've said it many times in this program and precursor programs, policy is very important, but policy must lead to practice, right? A conceptualization must lead to execution, right? It's important to bridge the policy practice gap. Very, very important. So Germany looked at it and said, why are these nations, or why is it generally that globally there is a challenge with implementing national health literacy plans? I thought that was very important. And one of the things they saw is that there needs to be a more bottom-up approach than a top-down approach to the implementation of national health literacy plans. I'll repeat that. One of the things they saw is that there needs to be a more bottom-up approach than a top-down approach to the implementation of national health literacy plans. And if I may add, before you can have a more bottom-up approach to the implementation of national health literacy plans, then there needs to be a bottom-up approach to begin with the creation of that national health literacy plan. A bottom-up approach simply means you are involving many stakeholders. You're taking a multi-stakeholder approach to the implementation of that plan. But if you are going to take that inclusive, broad stakeholder wide and broad and inclusive stakeholder approach to implementation, then to begin with, even with the creation of that national action plan to improve health literacy or national health literacy action plan, you must, to begin with, have involved those whom you expect to be part of the implementation. This is very, very important. If you do not involve them in the creation of the national health plan, it's not going to be so easy to now ask them to be involved in the implementation of the national health plan. And if you do not involve them in the implementation of the national health literacy plan, generally what Germany saw was that there might be a challenge to move from policy to practice. This is still Tolu Modara on Educating for Public Health Literacy. We have been looking at different nations. We looked at the United States. We looked at the United States National Action Plan to improve health literacy. And today we are looking at Germany, right? Germany submitted a national action plan, was designed and submitted in 2018 to the Minister of Health in Germany. And the overall objective of this plan was to create an alliance that includes all sections of society to enable compliance with that, to enable compliance and to ensure a sustainable implementation of the health literacy plan. I need to repeat that. In Germany, a national action plan for health literacy was submitted in 2018. It was developed in about 18 months, by the way, 1.5 years, and was submitted in 2018 to the Minister of Health, or what we call the Secretary of Health in the United States, right? And the overall objective of this national plan was to create an alliance that includes all sectors of society, take note, to enable, right, a very comprehensive and inclusive approach to the sustainable implementation of the health literacy plan. This is very important for me. I can tell you a lot that, as somebody who has been interested in bridging the strategy performance gap in private sector and bridging the policy practice gap in the public sector, I can tell you that one of the biggest challenges to implementation or execution is a non-inclusive approach. Once you do not ensure co-creation is observed and strictly protected as a principle to strategy creation or policy creation, you can almost be sure that there will be a challenge with implementation, or, to use the words of the German policymakers, sustainable implementation when it comes to execution of whatever policy you have created. So this was the lesson that Germany learned from evaluating the national health literacy action plans of other nations. They looked at it globally, they looked at what the challenge had been, and they said, okay, what can we do differently to ensure that we do not just, create a national action plan for health literacy as has been done by other nations, but that we create one that is actually implemented, number one, and number two, sustainably implemented. First of all, I think we really must commend Germany for this. We must commend them for wanting to take an approach that guaranteed not just implementation, but a sustainable implementation of a national health literacy plan. Well, this is still Tolu Omodara here on Amogate Radio Communications, discussing the issue of educating for public health literacy. And today we have gone from the United States into Germany, all the way in Europe, and we are looking at the lessons they had learned from generally reviewing national action plans to create health literacy, right, or national health literacy action plans, and especially the part of implementation. And we'll be back shortly. Okay, welcome back. So let's go back to Germany. So what did they learn again, right? One of the things they saw was that very few countries have actually had any experience with implementing action plans, right? Very few countries. Take note of that. This is 2018. This is just 5 years ago. That very few countries have had any experience with implementing action plans, right? Given the fact that there is a complex system of policy and practice. This is a whole program on its own. I mean, I'm just saying we cannot go into the depths of this in this episode, because this itself merits a whole program, bridging the policy practice gap in public sector. It's a whole program on its own. But suffice to say for now that Germany looked at it and said, well, very few countries have had any experience with implementing action plans. Take note, they didn't see that very few countries had experience with articulating action plans, right? National health literacy action. That was not where they thought the challenge was. Where they thought the challenge was that very few countries have actually had any experience with implementing national health literacy action plans. And they felt that part of it was because these action plans were supposed to be implemented within the complex systems of policy and practice. So the complexity of policy and practice, put it very simply, of migrating from planning to implementation, right? From strategy to execution. So there are several systems. A system means that there are several interacting parts. Is a whole composed of several interacting parts. So they looked at it and said, because of the complex structures that constitute policy and practice, and that weave that web, W-E-A-V-E, that weave the web, right, that make it possible to make sure that what is conceptualized as a policy, even articulated and documented as a policy, actually makes it to the point of practice, because of the several interacting parts that are important to come together to guarantee the delivery of practice from policy, right? Because of all this, Germany said, you know what, this has to be looked at in a manner that ensures that we are very conscious of implementation. Another thing they saw was that the systematic discussion of the implementation strategies and aspects of public or of action plans on health literacy is actually just beginning. Let me say that again. Germany, as a prelude or in the process of developing their national health literacy plan for 2018, they discovered that the systematic discussion of implementation strategies and aspects of action plans of health literacy is all just beginning. So the world is actually just beginning to discuss how to educate the public to ensure there is sufficient health literacy. I'm not going to go into what are the benefits of this. We've talked about this in previous episodes, but let me just highlight some of them. A lot of health costs can be cut down significantly if we focus more on health literacy. Number two, preventive health, which a lot of medical practitioners are now emphasizing. Preventive health is actually much easier to achieve when you have a health literate public. Number three, of course, what is most important, the lives, the quality and the quantity of lives. Quantity meaning we will have more people living out the fullness of their days. Quality meaning those who are alive will be alive and well and whole, right? So the quantity and quality of lives is likely to be much more preserved if we have a health literate public. There are so many. So whether it's from the financial point of view, from the health point of view, from the issue of life expectancy, there is so much that we stand to gain through health literacy. If we have a health literate public, it's already been established that nations will spend much less and gain much more. I'll repeat that. If we have a health literate public, it's already been established that nations will spend much less and gain much more. And so, given how important this is, given how important public health literacy is, it's interesting that a systematic discussion of the implementation strategies of health literacy action plans is actually just beginning. I don't want to ask why. Let's not look, maybe in this context, we won't look back too much. I want to ask, how do we go on from here? How does the world begin to discuss health literacy more? How does health literacy not just become a policy issue, but a policy that makes it to the point of practice? Because apparently a number of nations are beginning to incorporate this into policy. We saw Australia, we looked at Australia in the last 2 or 3 episodes. We looked at America in the last episode. Now we're looking at Germany. So a number of nations are beginning to see that there is the need to discuss and incorporate health literacy into their policy, into their public health policy. But apparently, what Germany found out about 5 years ago is that the issue of practice of this public health literacy policy being transited effectively into practice is something that still needs to be delved into, number one, and that apparently we also do not yet have sufficient discussions on ensuring implementation of national public health literacy action plans. This is still Tolu Omoda, and I'm finding this very interesting. I'm finding it very enlightening. I'm finding it very challenging too. It's a personal challenge to me. How do we ensure that we continue to advocate for public health literacy till we increase the consciousness across nations that there is the need, one, to, yes, have public health literacy plans, national action plans, but also to review those plans to look at the things that are challenging implementation and to ensure that we deal with those things so that we can have enhanced implementation of national action plans for health literacy. Well, let's at least wrap up today by kind of zooming in a little bit more on one thing that at least Germany has discovered as a challenge to implementation. They've discovered that the bottom-up approach, or the insufficient adoption of the bottom-up approach, can very well be challenging the execution of national health literacy action plans, right? So they saw that there is less evidence about the effectiveness or the efficiency of top-down strategies for implementing action plans or expert recommendations. So if you have quote unquote experts, national health experts, public health experts, and so on, who just sort of want to toss down or quote unquote impose the recommendations for health literacy on those who are supposed to support the implementation at the community level, civil society level, even religious organizations that can come together, that can collaborate with the experts, right, to implement these strategies. If there is a top-down approach, right, instead of a bottom-up and a collaborative approach, there is likely to be a challenge with implementation. So in Germany, what they found out is that in order to implement a national action plan, it is important to involve not only the political decision makers, but also the relevant bodies, the organizations, civil society, right, and all those that will come together to implement and ensure the actualization of the action plan. So their conclusion is that a bottom-up collaborative implementation strategy is indeed necessary, right? A bottom-up and collaborative implementation strategy. So this is what Germany is saying. They're saying that it's not enough to have a national action plan for health literacy, right? It's also important to have a strategy for a collaborative implementation of that national action plan for health literacy. Do you understand what I'm saying? So it's like after you create the national action plan for health literacy, they are saying that if that health literacy national action plan, if that national plan for health literacy is actually going to make it to the point of implementation, then it is critical to still sit down to create a strategy for a collaborative and bottom-up approach to the implementation of that national action plan for health literacy. Otherwise, the plan will remain a plan as they saw from their review, from their evaluation of several other nations. Well, this is where we are going to draw a curtain on today's episode of Educating for Public Health Literacy. Today, we are really speaking to policymakers. We are going deeper into the implementation issues, right? And we started by looking at the 7 key goals of the United States National Action Plan for Health Literacy, which was developed in 2010. We kind of zoomed in on goal 5 and goal 6, and I said I was going to tell us why later. Goal 6 of the National Action Plan to improve health literacy was to increase basic research and development and evaluation, right, of the processes to improve health literacy. And I said that is very, very important. We need to evaluate, we need to measure what worked, what's not working, why is it working and why is it not working. And goal 5 was to build partnerships, develop guidance, and change policies. And I said I was going to tell us why I wanted us to take note of those 2. Now we have looked at Germany. Germany created a national action plan to improve health literacy in 2018. They spent about 18 months working on it. Part of what they did was to look at other nations, what were the things that may have challenged implementation, not the creation, but the implementation of their national action plans to improve health literacy. Germany came to a conclusion that goal 5 of America's National Action Plan to improve health literacy is something to watch. That's building the partnerships. You cannot adopt a top-down approach and expect an effective implementation of the National Health Literacy Action Plan. That was what Germany saw. We need to focus on collaboration. We need to focus on partnerships. We need to focus on a bottom-up approach. We need to take an inclusive approach. And so Germany said, even after we have developed the National Action Plan to improve health literacy, right, based on our evaluation, right, based on the evaluation we have done, then it is very important to also create a strategy for a bottom-up collaborative implementation. Their conclusion was that a bottom-up collaborative implementation strategy for the national action plans to improve health literacy is still important. So we need more than one strategy. Germany is saying, yes, create the national action plan or the strategy to improve public health literacy in your nation, but also create a strategy to ensure that there is a bottom-up collaborative implementation approach. This is probably sounding like a lot to take in, but it's very important, it's very crucial, it's very necessary. And we hope that, like we always say on this program, those who have what it takes to implement, to make the necessary changes are listening, or those who can speak to them are listening, and the change that is necessary will be made. Thank you. Well, it's on this note that we draw a curtain on this week's episode of Educating for Public Health Literacy with Tolu Omodara here on Amogate Radio Communications. It's been very enlightening, very interesting, and like I said, personally to me, very challenging. It challenges me to want to do more, to go on with the advocacy, to keep sounding that voice for change until this becomes an issue of not just national focus, but global attention. Thank you so much, and we look forward to hearing back from you. Hope to see you next week. Bye.